This is Kenya. The year is 2007. With the rising number of deaths, especially due to HIV and AIDS, more and more children are being orphaned. Currently, we have around 1.8 million orphans, out of which 365,000 are double orphans and 700,000 have been orphaned due to AIDS. With most families in Kenya hard pressed for survival, their capacity to absorb orphaned and vulnerable children, OVC, is overstretched. A way out had to be found. The cash transfer program, which is being implemented by the Children's Service Department in the Ministry of Home Affairs, is aimed at providing a social protection system through regular cash transfer to families looking after OVC in order to encourage fostering and retention within their families and communities, and to promote their human capital development. The enrolled families receive cash payouts every 2 months to enable them provide the basic needs of these children. A stringent selection process has been put in place to ensure that the most deserving families are enrolled in the program. In the 17 selected districts where the program will be implemented, geographical areas or locations are selected based on poverty levels and the prevalence of OVC. The selection process involves checks and balances with the communities and the work of the independent enumerators. Each location selects members into the location OVC committee, which works with the district's children's officer to identify the eligible families. For a family to be eligible, it has to be poor, to be caring for an orphan or vulnerable child, and should not be receiving any other support. Once the families are selected, a community meeting validates the selection by endorsing only the deserving cases.
The selection is usually based on, at least we have these key people in the communities from the relevant ministries. Like in the committee, we want somebody from education within the location to be on board in the committee. We also want somebody from the Ministry of Health to be on board in the committee.
The people are having a very high hope because the way it is done, it is from the family's grassroots, from down. So they know they are going to be assisted in any manner because there is a lot of transparency without doing other dubious things.
Each family representative is then issued with an identity card that she or he will produce at the local post office to receive the cash payout. Other delivery mechanisms will be tested in future. Delivering cash directly to the beneficiaries reduces the administrative cost of this type of program to around 10%. This ensures around 90% of total finances reach the beneficiaries. Phase 1 of the pilot showed overall positive impact on welfare of beneficiaries and households, which reported using the money to buy food, school uniform, and pay for health care of the children. Phase 2 is reaching 10,500 OVC in 17 districts. The program will scale up in the year 2007 to the year 2009, up to 100,000 OVC. The total targeted population is 300,000 OVC. A comprehensive operational and impact evaluation of Phase 2 is being developed and focuses on 3 main aspects: welfare and economic impacts of the beneficiaries, operational effectiveness including cost evaluation, extent to which the program reaches those in greatest need. The cash transfer program is promoted under the UNICEF and Government of Kenya partnership. UNICEF provides technical assistance and supports fundraising and advocacy activities with international and multilateral organizations.